And then another person, Amy, said, sadly, you should have issued a mandatory mask requirement. You should do it now. I think what's important here is that Coloradans don't view this as anybody's effort to control what you do. In some areas of our state, there are mask requirements when you go into stores or public places. Some cities in our state, across our state, the workers in stores, for their own safety and the safety of their customers, are wearing masks. But this is a choice, and I encourage you to make the informed choice and the right choice.
Welcome, everyone. I'm Spiro. I have joining me Dr. Andrew Kaufman, and we were just recording for another report on a totally different topic, but this is an important topic as well, and I wanted to get Dr. Andrew Kaufman's take on it while I had him here on the line. And this topic is masks, because right now masks are being mandated all over the country and around the world, and there's a lot of debate concerning the effectiveness of wearing a mask and even the legality of governments forcing people to wear the masks. So, Dr. Kaufman, where do you stand on this mask debate? Do the masks help keep people safe from this deadly virus that we're told is so dangerous and deadly?
Well, there's no evidence that supports the mask being useful in terms of preventing any illness. And there have been several studies looking at influenza that have not shown a benefit. In fact, in one study, cloth masks were shown to have a higher infection rate with influenza. And there are good reasons for that. And, you know, masks have been kind of a pivotal issue for me personally, because I was terminated from a job because I was refusing to wear a mask. And, you know, part of the reason for that was, aside from that it's not beneficial, but it's a barrier to communication. And, you know, that job, I was being a psychiatrist. So, you know, people tell you very, very personal things. And, you know, you need to see the facial expression, because people can be very, very vulnerable. And, you know, for some reason they weren't very amenable to that accommodation. But no, I don't really see any reason to wear a mask, but I see many reasons why it can cause a variety of health problems.
Now, I recently ran a poll on Twitter, you know, asking people to share their thoughts of whether the masks keep you safe. And of course, take it with a grain of salt. This is my Twitter account, so it's going to lean towards, you know, people who are following me or who may see it on Twitter. And I was just asking, basically, is this sound science or something else, for people to share their best evidence supporting their argument below. And over 2,300 people voted, and the results were 12.7% said yes, they believe masks help, and 87.3% said that no, masks do not help. And I really encourage people to go and look at the thread, because there was over 185 comments in this thread, and they were pointing to a lot of interesting information. And one of them I want to highlight here is from the New England Journal of Medicine, and it's the second paragraph here, and it says, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as a face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, some say up to 10 minutes or even 30 minutes. The chance of catching COVID from a passing interaction in public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic." And of course, that's all we've been seeing and hearing from the media, for example, who has been spreading fear about this. Every day we're hearing about the numbers going up, and now we're getting masks mandated. You know, so I mean, why are they mandating these masks? Is it just that the politicians don't know what to do, so they want to make it look like they're doing something proactive here? Or is there something else? They're conditioning us for the next phase, which would be mandatory testing or potentially the mandatory vaccine, which we discussed previously?
Well, yeah, there certainly is a series of things that they want our cooperation with, and the more we cooperate with each step, I think it's an indication that we'll cooperate with the next step. So I think that is part of it. But masks, I think, there's more to it, because it keeps people separate from each other. You can't have a conversation with someone. I mean, I was trying to pick up some takeout for my kids the other night, and the person behind the counter was wearing a mask and trying to talk to me, and it just sounded all garbled. I couldn't really understand him at all. So it's a major barrier. You can't read facial expressions. You can't speak really. So it keeps us apart, just like social distancing does. It also increases the risk of illness because, and there are many studies that show this, by the way, it decreases the amount of oxygen in your blood. And in addition to the scientific studies, you have lots of groups of nurses that have recorded little videos where they check their pulse ox while they're wearing the mask. And it drops down into the level that if they were a patient, they would be put on oxygen. So it also violates OSHA's safety standards. So they've done testing with oxygen sensors between your mouth and the mask, and it drops down to about 19% or below, and 19.5% oxygen is the low cutoff for safety for workers. So actually, according to that, anyone who is supposedly required to wear this to work, every law or guidance that I've seen always has an exception for OSHA standards. So you can basically use that to get an exemption from wearing a mask at your job. And then also, despite the rhetoric in the mainstream media and even many politicians, announcing that it's mandatory, if you actually go on the right government website that has the authority to do that, you'll see that it's not actually mandatory. And I'll give you an example that from New York, because I just looked into this yesterday after I heard Peggy Hall talk about some things in California to see if it was the same here. And what I found was both for private people and for employees working with the public that are both, there's an executive order for both of them requiring mask wearing. But actually, the governor doesn't have authority over individual people. So in other words, if the governor says an order to you, they can't give you an order. The only thing they can do is give an order to a government agency. And in most states, the agency would be the Department of Health. So on the Department of Health website in New York State, they have one page for each of these executive orders, one for employees and one for private people. And it's basically a guidance of how to follow that order. And in both situations, it uses the term guidance, which means a recommendation, not a mandate. And in both, it says that if it makes a medical condition worse or causes a problem to your health, you don't have to wear it. So you don't need to go any further than that to see that it's actually not mandated in any place that I've looked so far. So I would encourage people that don't want to wear that to actually just take a look. And then one thing further it says in New York is that any employer or any authority is not allowed to ask you for your specific medical reason why you can't wear it, because that's private information, governed by federal law. So you don't have to say a thing except, that you're not wearing it. And, it might not be a bad idea to print out a copy of that page so you can show someone the text if they really give you a hard time, but they really have no leg to stand on if they try to bully you into wearing a mask.
That's very important information, because that's exactly what it seems. I would say bullying is accurate, and using fear tactics. I've seen in the past how the CDC has a brochure. Basically, it's like a guide on how to foster demand for vaccines, and they are talking about using fear-based tactics to get the media and other politicians and people to try to scare people into believing that there is a need to foster that demand for a vaccine. And it's so, again, this is what we're seeing take place all around us. This is a lot of information out there going both ways, and I just wanted to get your take on this, Dr. Andrew Kaufman. Very informative as always, and it's very interesting. I didn't know that you were let go from your job because you because you refused to wear a mask. And basically that just happened to my father as well. He was told by his employer, and he does not work in any sort of a customer service related or healthcare related job. He doesn't interact with the public at all, in fact, with his job. And they came out and said that you have to wear your masks. And he said no, and he walked out. He basically walked out in protest. And so, we're seeing a lot of this. Unfortunately, I think not many people are willing to do that. I don't think that many people are in the position to do that, and frankly, neither is my father or anything like that. But imagine if people did that in mass. If everyone said, no, we're not going to follow this ridiculous, these mandates or suggestions or guidance, it's just people are, it seems like they've been trained pretty well incrementally to just go along with what they are being told by authorities at this point.
Absolutely, Spiro. And, I took a risk too because, I have a family to support and I didn't really have an immediate backup plan. And, any other doctor job would also require me to wear a mask. But I did have legal recourse. I mean, I was in the right legally. And but I chose not to go that route because I wanted to move on into something better. But, I would say to people out there, two things. One is that you actually can't really be successfully fired. You should just say that you want to call the OSHA compliance officer, and that should probably shut them up temporarily until they at least look into it and see that you're in the right about that you cannot be compelled to wear the mask in order to keep your job because it's a safety issue for you. Because it's unsafe to wear a mask, and it's even more unsafe if you're doing any kind of demanding physical labor. So, and then the other thing is that there just is a time when you have to take a risk and stand up for yourself. In my estimation, this is the time. It's not time to wait. This is the time to stand up because, as you can see, more and more of our freedoms are being taken away. And if we don't stand up, it's going to just continue.
I couldn't agree with you more, Dr. Andrew Kaufman, on that because things are only escalating on a daily basis. And right now, they're trying to soften us up by telling us that we have to wear masks when you just clearly pointed out that, no, based on everything you just told me, and I have seen the OSHA standards that you were talking about with the 19.5% oxygen and below is considered dangerous, in dangerous environment. So based on everything that you just said right there, they don't have a foot to stand on as far as forcing you to wear a mask to keep your job. As they're trying to essentially, it's like a form of blackmail or ransom. They want to hold you ransom. Hey, you have to do this or you won't be able to get a job, keep a job, pay your bills, feed your family. And that's where we see this going, I think, ultimately when we start looking ahead in the very near future as this vaccine starts to roll out, because they've been talking about the health passports, the digital IDs, everything like that, you not being able to travel or work or anything unless you comply with this system. To me, this is a form of ransom and blackmail.
I agree.
Dr. Andrew Kaufman, thank you so much for all the time that you've shared with me today. Andrew Kaufman, MD.com is the site. Any final points you'd like to share with us, Dr. Kaufman?
Well, I think, we covered a lot and, just to reiterate, you have to advocate for yourself and stand up for yourself and do what you think is reasonable.
Well said. Thank you for joining me, and thank you for everyone out there watching. Please be sure to share these videos. It's critical information. The time right now is very important to get this information out there. I'm Spiro. Stay tuned for more.